Hi, my name is Kathleen Gibson, and I'm on the board of the American Vein and Lymphatic Society. And I'm going to share with you some of my thoughts about the COVID epidemic and kind of my experience being in one of the first epicenters in Kirkland, Washington. We were the city with the first death. We had COVID come into a skilled nursing facility that's about a mile from my house. And that was very devastating. And it appears that it then spread to multiple other nursing homes in our area, probably by some contracted caregivers, or it's really not clear how. But, we were the first community in the country that was affected. And so I'm going to tell you a little bit about what's going on here, and then talk to you about what impact it's had on my vein practice and some recommendations that you may want to follow. So our current situation is in the state of Washington. We are now in shelter in place, so all non-essential businesses are closed. You can still get takeout at restaurants. Bars are closed. There's no gatherings of groups of people. Our parks are closed. And so we're really trying to do shelter in place, and that's been for about the last week. Before that, there were some recommendations of not gathering in groups of various sizes, but people weren't following that as well as they could have. On the weekend, it was beautiful here, and the state parks were packed and the beaches were packed. And so hopefully now with this shelter in place order, people will take this more seriously. And yesterday was the first time I ever saw something that looked like a good bit of news, that our increase in case rate here was less than 10% increase, or around 10%, which was an improvement. So you can take what you can get. Maybe it's just a blip and an anomaly, but I'm hoping that some of this social distancing will work. And this is one of the first times I've actually hoped for heavy rain. In our area, we've had some beautiful days, and heavy rain would keep people inside and maybe away from places that they can congregate. So for places, if you live somewhere where this hasn't hit yet, please take it very seriously. The time to act is before you have a big outbreak. We have no elective surgeries going on, no elective cases at all. There's fear of running out of ventilators. There's fear of running out of protective gear for healthcare workers. And we as specialists need to do our parts too. So my practice also does arterial surgery, so we're still on call. We're doing carotid cases, symptomatic carotid cases, people that need amputations, people with critical limb ischemia, things like that. But we have suspended almost all of our vein procedures, which I think is the right thing to do, as economically painful as that is. So in this current situation, that's kind of an overview. So things are bad here, but not as bad as some of the places in the East Coast like New York. And hopefully the community you're in will be better than this. So I think that the current situation, the responsibilities you have are to yourself, protecting your family, protecting your patients, and protecting your community. And as physicians, we can have parts of doing all of those things. So in terms of protecting yourself, practice what you preach. The only two places that I am going are to work and home. I am not going anywhere else. We are getting our groceries delivered once a week, and practicing safe guidelines of getting those. When I go to work, I am currently now, if I'm seeing a patient, wearing a surgical mask and gloves and eye protection. That's not necessarily the recommendation, but that's what I am doing. I am distancing myself from patients as much as possible in terms of not standing right next to them and only getting close when I need to. I do have an N95 mask that was fitted by my facility. I got one. I have to take good care of it. If it becomes soiled, I think that I can probably get another one, but I'm not sure. And again, a reminder, N95 masks should undergo fit testing. And for example, the standard 3M mask doesn't fit my face because my chin is small. So I needed to get a special mask. So it's well worth getting protection yourself. Of course, wash your hands. Try not to touch your face like I just did. I am at home and I've washed my hands recently, but wash your hands frequently. I'm washing them enough that I have a rash on my forearms, but do take that into account. When I do go to work, even though I have a desk that I only share with one other doctor, I wipe everything down with a Clorox wipe, including the phone, including the keyboard. I try not to put my cell phone down on surfaces that I could pick up coronavirus. That's a hard one, but I'm cleaning the cell phone a lot as well. And then when I go to the hospital, if I'm using a shared keyboard, there are wipes around, and I make sure that I use them. We have Dragon for dictation at the hospital, and I also make sure I wipe that down when I use it. So somebody said, pretend that everything is covered with poop, and that you don't want to touch your face with it, and you wipe everything down. And we need to make sure that we're protecting ourselves. So we have also in our clinic purchased some UV lights for room sterilization. So I don't know whether those can still be obtained, but we are sterilizing rooms that patients are in. In our waiting room, we're keeping them apart if we can. So protecting yourself, I just talked about. Your family, what you're going to do with that depends on what your situation is and how old your kids are, etc. So I have one child in college that's up in Canada. She's not coming home because they have less, even though her school year is getting done in April, they have less corona where she is than we have here. She has asthma. I'm keeping her up there until the situation is better here. I have a teenage boy that's been having virtual school since the beginning of March. His school was one of the very first ones to switch over, and luckily they have the resources that he goes to school every day virtually, and my husband's working from home. So those two are pretty safe. They haven't left the house, which is hard on the teenager for sure. But I'm okay being mean about keeping him home. He hasn't seen friends other than virtually. And so the weak link in our family is me, because I am still working. And so today I'm off. That's some videotaping in our master bedroom. And I've converted with a plywood and some crates. I've made myself a desk in here, because the home office where I do have a desk is shared with my husband. We have a bathroom. So when I come home, and a lot of people think this is extreme, but again, I don't want to get my family sick. I wear scrubs only to work. I wear a hair cover. I wear my hair back. I've taken off my rings, my jewelry. I strip down in the garage. I take all my clothes off and put them in a bag. They're scrubs. And I've got a robe out there that I put on. I put a mask on as I walk through the house. And I go immediately to the master bath shower, and get into home clothes. And if I leave the room, and I try not to go where they are, if I have to leave the room, anything outside the room, I'm wearing a mask or wearing gloves that they may touch. And the great part about this is my husband's making dinner every night. He's doing the cooking, and they leave food by the door, and I'm eating with plastic utensils, and I wash them in the master bathroom sink, and use disposable things like that. So that's what I'm doing. Luckily, I've got a mini fridge in here. I've got Netflix. I've got my computer. I've got a nice comfortable bed. The only ones that are a problem are my unpaid assistants who are not complying with social distancing. I'm not petting them because I've heard pets can be fomites, but anyway, if I did get sick, we'd probably have to figure out something for them to do where they're not around me, I should say. So we talked about protecting my family, me. Now, my patients. So this gets into the part of the practice. It's very difficult. We are a private practice. We're a private practice of 4 vascular surgeons. We've cut out all elective vein cases, other than patients with bleeding varicose veins, patients with wounds that we don't think will deteriorate, or that absolutely have to have wound care. And unfortunately, some of those patients tend to be older and higher risk both to us and to them coming in, because usually they're older, and some of them are from skilled nursing facilities where we've got a lot of COVID. So with the wounds, we're fully protecting ourselves with PPE, but we're trying to avoid seeing the wound care as often. But we're seeing DVTs and STPs. That's it for veins. Arterial is just for urgent cases. Otherwise, we've switched entirely to telemedicine. And we've done this within 2 weeks, which is quite a switch for what we're used to doing. So this protection of the patients is that we do not want them out and about. We want them staying home. I've had some varicose vein patients that have wanted to come in that say, oh, this is a great time, I've got plenty of time, and it's not encouraging the social distancing that we need to do to see those kind of patients. Now, we can do telemedicine with them again. So protecting our patients, if they do have to come to the office, we're trying to not have people packed in together. We've got 3 locations. We've downsized to our biggest location where we can spread people out. We are cleaning the area where anybody's been sitting immediately with Clorox wipes. And again, we do have the UV sterilization that we take into the room after the patients have been there. So we're trying to also have them fill out their paperwork online if they can, and really protect them as well. For the community, I think that setting an example yourself, not poo-pooing this, not spreading the myth that drives me crazy that's been going around that this is no worse than influenza, which is ridiculous. Those sort of things, being a good example, being responsible on social media. You know, I'm not a huge Facebook fan. I do have Facebook, but I started really not getting on Facebook very often, and I've kind of gotten back on and informing relatives of mine and friends of mine about what the truth is and about how they need to stay home and how this is the real deal, and how part of the flattening the curve that we've heard so much about is not so much that we will necessarily not have patients getting the disease, but spreading it out so that the healthcare system doesn't collapse. And the fact that despite this epidemic going on, people are still going to be getting they're still going to be getting appendicitis, they're still going to be having MIs, they're still going to be auto accidents, and if there are not ventilators for these people, or staff is sick and the surgeons are all ill, then what are we going to do? You know, so you need your healthcare system to have a healthy society. So I'm educating friends and relatives on social media, but then every patient encounter that I have with telemedicine, every single one, I'm talking to my patients about safe practices of staying home, about hand hygiene, about things like safe shopping. There's several videos online that talk about what to do when you get your groceries delivered. I was horrified to see on social media someone I know that a young woman who's like, I think that this is all a hoax. I think we all should go back to work. And I've started working at Instacart, and I'm still going to parties and all of this. And I thought, oh my gosh, the people that she's delivering groceries to, I hope they're wiping the bags down. So there are some things that you can share with your patients about, like washing produce, about safe takeout, etc. This isn't something normally that I have done as a vascular surgeon, but I'm doing it now. So every patient contact that I'm doing, I'm taking an opportunity to educate my patients about safe practices. So then finally, little note, telemedicine. It's easier than I thought it would be. I find that the patients are super forgiving of not seeing me in person. And what we've been doing, if we have a patient that has had a vascular lab previously that I need to talk to them about, is we can, in our EMR patient portal, paste that report, ask them to read it, or it has been available to them anyway. If they can't get into the portal, we have the secure internet that we can send them email about it. People can send you pictures securely if you've got secure email. And I found that they're very grateful that I'm not asking them to come in. And so what we're hoping is that we will get appropriate reimbursement for this. We don't know. But again, I think that those financial concerns need to be secondary to our responsibilities, again, to ourselves, our patients, our community. And remember, seeing patients in person not only puts risk to them that they have to come in and they have contact with other people, but it also, every single one of those patients puts some risk to you in that you may be practicing very safe practices and, like me, just going to work and home and not doing anything else and not socializing, but you do not know what they've been doing. So I think that that's all of my words of wisdom. I hope this wasn't too much of a rambling. I have hope that we will all get through this, that we will learn a lot about ourselves and our healthcare system during this. And if we get through it successfully, hopefully we'll have a lot to learn about what we need to improve. And I hope to see you all in Washington, D.C. at our meeting in October. Hopefully everything will be better by then. And I thank you for your time.